good afternoon, and good evening, and thank you very much for joining this webinar. My name is Baldev Ahluwalia. I lead the Beyond MR segment for GE Healthcare, and it's my pleasure to host the webinar for you today. I also want to make sure we thank the Organization of Human Brain Mapping, especially putting on the webinar and the conference in this very challenging time, and I appreciate the flexibility and the opportunity to share what we're doing from GE Healthcare. In addition to myself, there's two key presenters. One is Dr. Alan Song, who's a professor and director of the Brain Imaging and Analysis Center from Duke University. And the other person is Suchi Banerjee, who's a global neurodevelopment manager and MR scientist from GE Healthcare. Dr. Song will go through and present the ultra-high performance 3T system and high-resolution diffusion work that he's doing on GE platform. And Dr. Banerjee will go through and discuss the advances in neurosciences and neurodevelopment from an applications and development standpoint. It's my pleasure to announce on behalf of GE Healthcare a new product that we're introducing in the marketplace, and it's currently 510(k) pending with the FDA, and that's the SIGNA 7T. And here's a short video for the introduction. The SIGNA 7T is the next product in the portfolio of GE MR scanners, as shown here, starting with the SIGNA Creator on the left and moving all the way to the right with the SIGNA Premier, which is our latest regulatory approved and cleared high-performance 3T wide-bore scanner. This 70-centimeter 3T platform is a key architecture, and it's a new platform for GE. And we use that same platform for the SIGNA 7T system, as shown here, again, currently pending with the FDA. The SIGNA 7T is part of a portfolio for advanced systems for both research and clinical work shown here, with the clinical work on the right-hand side with the SIGNA Premier, the currently pending SIGNA 7T in the middle, and on the left-hand side is the ultra-high performance 3T system. Both the ultra-high performance 3T and the SIGNA 7T share the same gradient platform, architecture, and across these three systems, the exact same software and power electronics are used. As we move into the SIGNA 7T, it's a critical part of the portfolio, and it's where scientific discovery meets clinical translation. There's three things that are key here. One is that it's powered by SIGNAWorks, which is a comprehensive suite of applications, workflow tools, and unique acquisition and reconstruction techniques that are across the portfolio and really enable routine work on the SIGNA 7T as well as the 3T and 1.5T systems. In addition to the SIGNAWorks portfolio, there's advanced technologies in the ultra gradient platform and precision RF, and together they enable us facility to go with familiarity and freedom to explore the capabilities and the clinical capabilities of a SIGNA 7T system. Well, I first want to start with the SIGNAWorks portfolio. A key portfolio of the SIGNAWorks is AIR technology, and AIR is a family of products that delivers clinical versatility and comfort, including intelligent productivity improvements across the board. On the left-hand side, we have AIR technology, which is a unique technology that incorporates highly flexible and versatile elements for surface coil development for both neuro as well as other anatomy in the system. In addition to the AIR coil technology, there's AIR workflow, which is intelligent productivity and improvement, and also is key for consistency from one patient to the next throughout your experimental and clinical work. On the far right-hand side is the AIR image quality, which is really enabling consistently better IQ from your routine work and your advanced reconstruction, of which I'll show you a number of examples. In a little bit more detail, the AIR coil technology on the far left-hand side shows the 48-channel AIR coil, which is a unique technology, adjustable to fit 99.9% of all patients, and enables the coil to expand in size and shape so that all patients are comfortably accommodated. In addition, there's anterior arrays and multipurpose arrays. In the middle, I'll give you a few examples of AIR touch technology, which is an automated method for the system to automatically calibrate and optimize the acquisition to remove or eliminate artifacts and enhance parallel imaging capabilities. as well as AirX, which is the automatic slice placement, which is key for routine and consistent acquisition from one patient to the next and for repeat patient studies, which is critical in the research domain. On the right-hand side of this chart, there's a reconstruction and image quality enhancements through AirRecon, which is a new reconstruction algorithm that improves SNR and reduces artifacts and background noise, and AirRecon DL, which is just recently approved by the Food and Drug Administration, and which is a deep learning application designed to improve SNR, as well as enhance image sharpness and shorter scan time. From an AirX intelligent slice placement, it's about a 5x improvement in exam time and setup, and 4x times the reduction in number of clicks for technologists, whether that's in the research domain or in the clinical domain. Critical for repeat acquisition. Skipping ahead to the AirRecon DL, of which Dr. Banerjee will go through in more detail in the third part of the webinar today. Again, it's a deep learning reconstruction tool. It's optimized to improve productivity and enable shorter scan times by reducing image noise and ringing. This is a reconstruction tool that leverages the raw data directly from the acquisition and incorporated into the routine workflow for reconstruction. It delivers sharper and clear, true fidelity MR images. As part of the SIGNA Works portfolio is NeuroWorks, which is really enabling three things. It's enabling faster acquisition, consistent tissue contrast, and consistent image quality, as well as personalized acquisition optimized for each patient. From a fast standpoint, upper left, you'll see 3D fast spin echo and a hypersense method of acceleration for the vascular work, as well as hypercube and hyperband, which are, again, acceleration techniques optimized for acceleration through 3D volumes and multi-slice acquisitions. On the far right-hand side is Magic, which is multiple contrasts within a single acquisition. From a consistent standpoint, whether you're trying to consistently get the right tissue contrast or reduce artifacts from a diffusion standpoint, or remove issues from motion from the patient, there's a comprehensive suite of tools to enable that, and then also to optimize for the personalized acquisition, as you'll see on the bottom row. Moving to the SIGNA 17 now, or scientific discovery with clinical translation. Leveraging the SIGNA Works portfolio, we've taken advanced technologies, and I'm going to spend a few moments on here now. The SIGNA 17 is a combination of three key areas. One, a core magnet, which is the foundation for the system. It's a zero boil loss 7 Tesla with an integrated parallel transmit capabilities, and it's the foundation of our previous system, the Discovery MR950. In addition to that, we've added the portfolio of technologies within the SIGNA Premier system, which, for example, the advanced gradient coil technology, the total imaging works, and the SIGNA Works application suite. Most importantly, though, we've added new technologies specific for 7 Tesla, which is the Ultra G gradients, advanced shimming, and precision RF train, and married that with the two previous to really get together with the SIGNA 17. Going into a little bit more detail, the SIGNA 17 magnet technology, this is in partnership with Tesla Engineering out of the UK. It's the third generation actively shielded zero boil off magnet. It's a very low stress design. We've had 0 quenches in the install base after the installation of the system. And with that, we've been incredibly pleased with the robust design of the system. In addition, it has the smallest fringe field, and this enables the site to minimize the amount of shielding necessary to install the scanner. Moving from the magnet to the gradient technology, the Ultra G gradients are an advanced set of high-performance electronics, reaching a peak voltage of 2,400 volts and over 1,000 amps per channel, with dedicated feedback loops, regulated power supplies. And this is a common architecture across the Premier, SIGNA 7T, and the Ultra High Performance system. This is a key ingredient to the high fidelity and high stability platform that we have from gradient architecture. The second key component for the gradient technology is the Ultra G system. This is a 60 centimeter gradient platform that's common to both the SIGNA 7T and the Ultra High Performance 3T system, with direct cooling and hollow channels for both the X, Y, and Z gradient coils. Combining together the electronics and the gradient coil, the system delivers 113 millitesla per meter per axis, as well as 260 Tesla per meter per second per axis. In addition, the system has 10 high-order shims up to third orders. On the bottom left-hand side of this chart are 5 separate acquisitions that can run continually, going through different B values for 128 by 128 acquisitions on a 24 centimeter field of view. So you can run continually with a B value of 5,000 on the same axis with a TE of 65 And obviously, you would not normally run your acquisitions at about 1.6 seconds, but you can. This gives you an idea of the duty cycle of the system. An example shown here on the left-hand side is high-resolution diffusion imaging. These are 2x2 accelerations, a TE of about 58 milliseconds. And on the right-hand side is a fMRI acquisition comparing a 3T and a 7T system with 1.5 millimeter isotropic on the right-hand side for the 7T acquisition. Again, this is with the new Ultra-G gradient platform, and the images on the right are courtesy of Cornell University. Moving from the gradient platform to the RF platform, the precision RF transmit architecture is shown here. It's a fully integrated multi-channel architecture. Each transmitter has 2.5 kilowatts of energy at the proton frequency. It has integrated RF shim and RF design algorithms, and it can run in a clinical mode of a 2-channel configuration, or it can go in research mode for a multi-channel configuration. In addition to the proton frequency, there's also an 8 kilowatt amplifier for multinuclear spectroscopy and multinuclear imaging. Again, each channel has independent control of RF waveform for amplitude, frequency, and phase. Moving from the transmit side to the receive side, from the precision RF architecture, again, it's a 64-channel receive system for both proton and multinuclear capabilities, and it's scalable up to 128 channels. It fully integrates in terms of the system understands the coil connected, the coil capabilities, and it's a very open architecture that supports third-party integration. The third component here is the familiarity and freedom. It enables the combination of the power and of the SIGNA architecture, plus the advanced technologies of Ultra-G gradients and precision RF to enable you to drive the system incredibly well and very easily like the clinical system. To give an example of this familiarity and freedom, this is the propeller motion insensitive T2 weighted acquisition. This is a 0.4 by 0.4 acquisition with a high echo train length. Just to give you an idea on the true axial and true coronal acquisition, how the precision RF gets very uniform tissue contrast across the anatomy. And also in the motion insensitivity, gives you very robust images. Moving to a T2 weighted fast spin echo acquisition, high resolution work here. This is reconstructed with Air Recon DL, and additional giving you an idea on the fornix here, high resolution work, as well as the folds that you would not normally see from a 3T system, but shown incredibly well on 7 Tesla. Moving from fast spin echo to gradient echo, this is a 0.2 in-plane resolution work here. Again, what you would expect from a 7T of ultra high resolution work, a very good deep brain uniformity, very good deep brain signal to noise, and this is a combination of the precision RF and their surface coils that we're using from the technology today in the system. Again, this is part of the clinical evaluation and reader study we did for the 510K submission. This is a corresponding cube flare acquisition on the left-hand side and a gradient echo 3D on the right with a zoom into the hippocampus volume. Again, about a 0.4 by 0.4 by 0.7 resolution for each acquisition. Unique to GE is the 3D silent technology. This is a high resolution 3D volume acquisition, about 0.5 by 0.5 by 1 resolution. And again, you can slice as you need it and reformat as you need, but this is a silent acquisition. Dr. Banerjee will go through more details of what silent technology can do for functional MRI work. The acquisition noise here is about 3 dB above ambient, so barely above what you're getting from the helium compressor in the scanner. I think you all know from a 7 Tesla standpoint the strengths of high resolution gradient echo acquisitions as shown here with 430 micrometer resolution susceptibility weighted images. And this is a 7 millimeter thick slab as you've shown here for the axials acquisition in multiple different volumes as shown. Again, very uniform acquisitions, both right, left, AP, and SI. 7 Tesla does very well for vascular work as shown here on the 3D time of flights. 0.4 resolution acquisition with very good delineation and more peripheral vascular vessels. The strength that we see from both the precision RF and the Ultra-G gradients is stability in the system. And one example shown here, this is 1.2 millimeter isotropic fMRI, very good delineation and subtraction here between the fitted data and the real-time data. Moving to what I think is the most challenging acquisition at 7 Tesla is high resolution spatial diffusion. Example is shown here on the left-hand side. So this is an axial acquisition that's been reformatted in the coronal plane, and there's been no correction here in terms of reformatting afterwards. This is a combined 31 direction diffusion direction to give you an idea that there is no slice to slice shifting as you go through the anatomy. And when you overlay the diffusion data on the high resolution anatomical information, there's an incredibly tight correlation for both the coronal and the axial acquisition. And this is really due to the great performance we're getting from the AlterG gating technology. Similarly, when you go to multi-shell acquisitions for multiple diffusion tensor imaging, this is a V of 3000, a TE of 65 milliseconds, 66 directions, and 1.5 millimeter isotropic work. Again, the AlterG technology is showing very low distortion, no post-processing distortion corrected here for this acquisition. And I think an area where 7T will really benefit from the advanced gradient technology. Key to note that though we have the SIGNA 7T as a forward production system, it's also available as an upgrade into the install base of Discovery MR950 systems, as well as any shielded or unshielded magnet. And you can take this and get the AlterG gradient technology, the precision RF, the SIGNA works, the fully detachable Liber detachable table, as well as the flexible research platform that Dr. Banerjee will talk in the end. The first upgrade that we're hoping to be able to get done is in Pisa in Italy. And with that, we have Dr. Michela Tossetti, who came and evaluated the system at the beginning of the year. And when she visited in January, she was immediately impressed with the quality and stability of the SIGNA 7T system, and they're keen to upgrade their system when it's available. Again, two examples shown here, a 0.7 isotropic MP range and a 0.1 by 0.1 by 1.2 Fiesta acquisition, which is both very SAR intensive and high resolution demanding from a susceptibility standpoint. Similarly, we had Dr. Yi Wang from Cornell University in New York. This is the paper on the left-hand side of this chart, which is the first publication on the SIGNA 7T, which is a comparison of quantitative susceptibility mapping comparing 7T and 3T. And there's a repeatability study between these two field strengths, and Dr. Wang and his team, from his perspective, I could hardly tell the difference between operating a 7 Tesla and 3 Tesla from an automatic workflow, a smooth acquisition of pre-scan and imaging and parallel imaging preparation. So his operation of the system was incredibly smooth and enabled the research to be done very easily. And finally, from a feedback standpoint, shown on the right-hand side is a picture of Dr. Gary Gold, professor of radiology and vice chair of research and organization for Stanford University. And they feel that the integration of the new MR platform into the SIGNA 7T system has resulted in outstanding image quality and will be critical for the next generation of scientists, researchers, and clinicians. In addition to their feedback on the 7 Tesla, Stanford University, specifically the Dr. Adam Kerr and at the Center for Cognitive and Neurobiological Imaging, they have upgraded a system to the SIGNA Ultra High Performance 3T system, which is the same platform that Dr. Alan Song has installed at Duke University. And with that, I want to introduce